Welcome to Rural Doc Alan podcast. I'm excited. Welcome to the room. Rural Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. Our first topic for today is postpartum depression for dads. How common is postpartum depression for dads? Again, I never knew there was a topic like this, but I want to find out what those symptoms are. Go ahead, Doc.
Well, they say 1 in 10, and actually I think that's really hard to know because men are not taught to complain. So you're going to underdiagnose men with postpartum depression.
Does the mental health of parents affect the well-being of children?
Well, I've always said it's best if children have two parents, and it's best if they can both have good mental health. That's really important. Kids do a lot better that way.
All right, great. In dads, can depression and other mental health issues begin before the birth of the baby?
Well, yes. They say for some reason or other, first trimester for dads. But if you're looking at postpartum, then you're looking at 6 to 12 months after delivery.
And that's probably because we're getting no sleep. What are some common causes associated with pregnancy related to depression for dads?
Well, you've got declining testosterone for whatever reason. I couldn't possibly know, but it must be something.
It's called not getting any sleep.
Yeah, some of that, yes. And then there's partner's depression, and there is a personal history of depression. And as you said, sleep deprivation is a really big problem, which I think is underestimated. And of course, men, again, we're taught not to cry, we're taught not to complain. So it's going to be harder to figure it out.
I'm being more feedback-ish on this, but I know also the biggest thing is that dads kind of lose their role once having a baby or a second baby, or what I've dealt with having 6 kids, that they're forgotten. A lot of everybody kind of forgets the dad, and the dad doesn't get any sleep. That now dads take on 50% of the role of raising kids when they're together, where they're feeding a bottle at night, they're doing certain things, and they kind of lose some of their identity.
Well, you're absolutely right. It's very difficult for dads to get involved with the care. For example, when we talk about moms, and some places talk about the dyad, that is the mom baby, but it's much more than that. It's mom, dad, baby, and the other kids that are involved with the postpartum and with the depression.
But also dads are told now to go to work after getting 2 hours sleep, are told to do things that traditionally with more stay-at-home moms didn't have those roles, and go to maybe even more high-pressure jobs, and this is going to get me in trouble, and be able to have to perform and still do all that stuff without showing their feelings.
You're absolutely right. It's very difficult, and there's a lot of men who, there's one of two things happens with work after delivery. You either don't want to go to work, or you want to go to more work so you can get more money, so you can make things better for mom and baby and the rest of the kids.
What are some common symptoms of postpartum depression in dads?
Well, there's many, as you've talked about. Certainly sometimes violent behavior, angry outbursts, irritability, low motivation, watching video games all day, headaches, digestive problems, stomach aches. So there's a lot of problems, and even sometimes suicidal thoughts. And again, you're talking about withdrawing from relationships and work. So those are all problems for dads.
Yeah, and it said and work a lot more or a lot less, depending on the thing. It's a process when they look at parents and what parenting brings to the table. And we don't have a school for parenting, and I don't know why we don't, because that is the thing that is probably the biggest issue in the world. And well, I don't even want to talk about the dichotomy of what's happening now in relationships and how there's not even 2 people together anymore. There was an interesting podcast I was listening to yesterday about not many people are going to get married or even have a relationship anymore. What is the common pregnancy-related depression screening tool?
Well, the most common one is it's called the Edinburgh Inventory, and it actually was made in Edinburgh, Scotland. And it is given to moms. Of course, now it's also apparently okay to give to dads. Part of the problem is that most people would rather have somebody listen to them than test them.
Okay. Who would, so you talk about the Edinburgh, who would give the Edinburgh inventory test to dads?
Well, that's one of the really big problems. And of course, you know, I have advocated for the last 45 years, dads should come to the prenatal course because I think they have less risk of having depression, better chance of having good postpartum relationships. But dads really don't have access during the prenatal course to this Edinburgh Depression Inventory. So in view of the fact that we know dads don't get an opportunity either before or after, in other words, you're not going to go to your wife's prenatal or postpartum visit and get this Edinburgh test. So they're talking about peds. Now again, there's not an awful lot of dads who go to normal peds exams, and there's not an awful lot of opportunity to get the test. So I think it's rather a hollow recommendation. I think I'm going back to what I've said all along. Dads should go to prenatal visits.
How is paternal prenatal depression presently treated?
Well, there are many ways. You can, there's psychotherapy, there's complementary therapy like acupuncture, massage, exercise, and medications, just like you'd give to mom. The SSRIs, SNRIs, probably some Xanax or Ativan.
Okay. All right. The best place to go is ruraldocalan.com for more information, and you can purchase Pregnancy Away. It's available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was the Rural Doc Allen podcast, guys.